Hello, everyone. Good evening. I'm Sayukta from Bladder Wellness Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic benign prostatic hyperplasia, BPH. Now, BPH is the non cancerous enlargement of the prostate, usually begins in the 50s in men, and in many men may cause obstruction to urine flow. Many men have to get up and go to the toilet at night, and is one of the most troublesome aspect of this condition, and it makes them tired during the day. Sometimes, with a sense of urgency, can also be tiring for patients and can make traveling or attending social events difficult. A doctor, such as a urologist, can treat this condition and help the patient to get some relief. So, to shed more light on the subject and guide us on what's right for diagnosis and treatment on BPH, today we have with us renowned consultant urologist Dr. Varun Wats. He is MCh Urology. He has a rich experience of 14 plus years and hands-on expertise in urological health and stone management. And he is currently working at Anupam Hospital, Ludhiana. So Dr. Varun Wats have rich experience in the field of urology and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. It's such a pleasure to have you with us, Dr. Varun Wats. A warm welcome to you.
Thank you, ma'am. Thank you.
So, doctor, today we are going to talk about BPH. जिसे बहुत आम भाषा में हम enlargement of prostate बढ़ गया ये कहते हैं, and we all know that males have this particular gland called prostate. First of all, what does prostate? कहाँ उसकी positioning होती है? And then we'll come to BPH.
Prostate is a gland which is present only in males. ये females में नहीं मिलता. ये हमारे यूरिनरी ट्रैक के अंदर होता है एंड ये ब्लैडर में के बिल्कुल जहां ब्लैडर हमारा यूरिनरी ब्लैडर खत्म होता है where it ends there the prostate starts. It's a small gland and the passage of urine which we call urethra in medical terms. यूरिन की पाइप जहां से हमारा यूरिन निकल रहा है that pipe runs through the gland. In between, through the gland it goes and the urine comes through the gland. So that is a small gland in the passage of urine in males.
Mm-hmm. And now coming to our main topic, BPH, benign prostatic hyperplasia, जिसे हम enlargement of prostate भी कहते हैं. What is that, doctor?
Ma'am, benign prostatic hyperplasia, all three terms have specific meanings. Benign means that it is not cancerous. First
Right.
of all, benign का मतलब है and इसका opposite होता है malignant.
Mm.
बिनाइन अगर आप यूज करोगे इसका मतलब ये कैंसर नहीं है बिनाइन
Right.
प्रोस्टैटिक itself एक्सप्लेनेटरी प्रोस्टेट के बारे में हाइपरप्लेजिया मींस एनलार्जमेंट ग्रोथ ऑफ प्रोस्टेट
Mm-hmm.
in medical terms it is non-cancerous growth of the prostate. It happens because of aging.
Mm.
Like with aging our hair turns gray, our bones become weak, heart becomes weak. Similarly, as an aging process in every male, prostate has to enlarge. And this in medical terms is called benign prostatic hyperplasia.
Okay. And what are the symptoms, doctor, that one gets when he has this BPH?
Ma'am, there are various types of symptoms, but mainly two. We
Mm-hmm.
can categorize them into two types. One are obstructive symptoms and one are the irritative symptoms. Obstructive symptoms because of obstruction of urine. This can be because like poor flow of urine. Speed. Patient comes to us with the complaint of decreased speed of urination. मेरा urine रुक रहा है. That is the
Mm-hmm.
term which he'll complain about. मेरा speed कम हो गई है. मेरा यूरिन का फ्लो कम हो गया है मेरा स्पीड कम होने के कारण मेरा यूरिन बंद ही हो गया है बिल्कुल मेरा निकल ही नहीं रहा so these are the obstructive symptoms because of obstruction it can lead to certain things like fullness of bladder यूरिन अंदर इकट्ठा होने लग गया है मेरे मैं निकाल नहीं पा रहा प्रेशर इन द किडनीज वहां तक प्रेशर पहुंच जाता है तो किडनीज में स्वेलिंग आ जाती है विच इज कॉल्ड एज हाइड्रोनेफ्रोसिस so ऑब्स्ट्रक्शन, यूरिन बंद होने के कारण उसका फ्लो कम हो गया, वो निकाल नहीं पा रहा, यूरिन आना बंद हो गया है, किडनीज में पेन होने लग गई है, किडनीज खराब होने लग गई हैं, ये हो गया एक सेट ऑफ सिम्टम्स विच आर नोन एज ऑब्स्ट्रक्टिव सिम्टम्स बिकॉज यूरिन का फ्लो कम हो गया. वन आर इरिटेटिव सिम्टम्स. इरिटेटिव मतलब लाइक फ्रीक्वेंसी, बार बार जाना पड़ रहा है, increased frequency of urination, urgency, he cannot control the urine, when the urge comes for urination he has to rush to the bathroom, भागना पड़ता है यूरिन करने के लिए, मैं रोक नहीं पाता. ट्रैवल कर रहा
Mm.
होता हूँ मैं बस में या अपने बाइक पे या अपने व्हीकल में, एंड आई गेट एन अर्ज, आई कैन नॉट कंट्रोल इट फॉर 2 or 3 minutes, आई हैव टू स्टॉप द व्हीकल, pass urine and then sit again, I cannot control. These are irritative symptoms. Then post void dribbling, करने के बाद भी यूरिन निकल रहा है मेरा, right?
Mm.
And dysuria, जलन होने लग गई है, ब्लड आने लग गया है यूरिन में. All these symptoms can happen because of prostate enlargement, and या ऑब्स्ट्रक्शन के कारण होते हैं या इरिटेटिव सिम्टम्स के कारण ये
हम्म।
होते हैं. These are the mainly
खास
two.
तौर पे राइट, ये जो इरिटेटिव सिम्टम्स आपने डॉक्टर बताए, ये बहुत आम होते हैं एक सर्टेन एज के बाद एंड इररिस्पेक्टिव ऑफ जेंडर, लेकिन चूंकि हम बीपीएच की बात कर रहे हैं सो विल स्टिक टू मेल्स. नाउ व्हेन समबडी आस्क्स देम कि अरे बहुत बार जाना पड़ रहा है, फ्रीक्वेंसी बहुत बढ़ गई है, अर्जेंसी है, तो व्हाई डोंट यू गो एंड कंसल्ट अ डॉक्टर? एंड नॉर्मली अ पर्सन विल से दैट नो नो, सी आई एम एजिंग and these are
Yes.
all associated with my aging process, or I'm a diabetic, so I'm having, these symptoms. There are very few number of males who say or who know, who are aware कि ये जो symptoms है ये BPH भी हो सकता है, and we need to go and seek advice. भले ये एजिंग से जुड़ा हुआ ही है, लेकिन
Yes.
I'm sure you have treatment for this, right? So
Yes.
आई एम श्योर बहुत सारे ऐसे व्यूअर्स होंगे इस वक्त जो ये सेशन देख रहे हैं और वो सोच रहे हैं कि अरे ये सिम्टम्स तो मुझे भी होते हैं, फ्रीक्वेंसी, मुझे भी रात में कई बार उठना पड़ता है या जाना पड़ता है, या दूसरे मेंबर्स सोच रहे होंगे कि अरे हमारे घर में फादर को भी तो या चाचा को भी तो ये प्रॉब्लम हो रही है, तो अच्छा ये बीपीएच हो सकता है. वी आर नॉट दैट अवेयर अबाउट इट, आई थिंक. तो वो लोग जो अभी तक इसे एज से एसोसिएट ही करके बैठे थे या ये सोच के बैठे थे कि ये तो मैं मुझे डायबिटीज है तो ये तो कॉमन है, होता ही है, तो होता ही है, इसके साथ ही रहना पड़ेगा, क्या ये जरूरी है, और वी हैव सम वे आउट?
जी मैम, इसमें देर इज अ वे टू थिंक अबाउट इट, राइट?
हम्म.
They are thinking correctly, yes, they may be thinking correctly that it is an aging process and age के साथ होता है, that is one way.
हम्म.
But we have to make sure कि ये सिर्फ ही aging process है, जरूरी नहीं है, because इसमें prostate में these symptoms can occur, but these are not exclusive to only prostate. There are other diseases where these symptoms also happen. Like a patient is having infection, urinary tract infections. He'll have the same
हम्म.
symptoms. The patient is having
राइट.
cardiac problems, CCF. He'll also have the same symptoms. He'll also get up at night. The patient is having kidney problems. He'll also have the
हम्म.
same symptoms. The patient is having diabetes. He'll also have the same symptoms. The patient is having high blood sugar. He'll also have the same. So as a patient, you don't know whether what is the cause of symptoms. Showing to a doctor is just to make sure that whatever you are thinking, that is the cause, or there is some other cause also. And
हम्म.
whether we can treat those symptoms, whether we can improve the quality of your life or not, because getting up at night 4 or 5 times or going again and again, patient having increased frequency, urgency, the patient's quality of life definitely deteriorates. And
Definitely.
we can help them with this. Their quality of life definitely improves because your sleep getting disturbed at night or going to a meeting and having urgency is very, very bothersome to majority of patients. They learn to
हम्म.
adjust, but with medicines, their need for adjustment decreases. So their quality of life definitely improves. Plus, other diseases have to be ruled out.
Right. And as you said, that it's important to, get it checked,
Yes.
get a right advice from the right person, which is a qualified urologist.
Yes.
So I think the awareness regarding this is what we need to spread, and that is why we are having this session. कि अगर ये symptoms हैं तो प्लीज इसे इग्नोर ना करें, प्लीज ये सोच के ना बैठे कि अब तो एजिंग हो रही है, ये तो होगा ही, सबको होता
हम्म,
है। अगर होता है भी तो सबसे पहले ये पता करना जरूरी है कि क्यों हो रहा है,
हो
आपके
रहा
केस में क्या कॉज है और
है
किस
एग्जैक्टली।
तरह से आपको इससे रिलीफ मिल सकता है। लेकिन डॉक्टर,
यस।
क्या कोई पोटेंशियल कॉम्प्लिकेशन भी है अगर हम ये सिम्टम्स जो है इग्नोर करते रहे एंड द पर्सन इज नॉट गोइंग एंड गेटिंग इट डायग्नोज्ड और गेटिंग द राइट ट्रीटमेंट? आर
यस।
देयर पोटेंशियल कॉम्प्लिकेशंस?
See, ma'am, there are a lot of complications related to this. Uh, like if there is a complete obstruction, the patient will not be able to void. He'll not be able to pass urine. He'll go into retention. The
Okay.
the pressure which builds up because of urinary retention can go to the kidneys, like I've already told. So there is hydronephrosis of the kidneys. Kidneys can get damaged, right?
Mm-hmm.
And the patient can have blood in urine, can have clots in urine, can have clots in bladder. So these are the patient can have recurrent urinary tract infection, UTI we say. These are all the complications which can happen, and more so we don't know the see this is we are talking as a topic of benign prostatic hyperplasia, BPH.
Right.
This is a theoretical discussion, right? The patient's
Mm-hmm.
symptoms in a prostate cancer will also be the same. So he
Okay.
doesn't
Right.
know. He'll have the same symptoms, same set of symptoms. Prostatic enlargement can be because of cancer with age and can be because of benign prostatic hyperplasia, which is an aging
Right.
process. The symptoms of both these conditions for the patient will be the same. It is for us to
Mm.
decide as doctors what is the patient having. So the patient ignoring his symptoms, thinking that it is benign prostatic hyperplasia and it is an aging process, he doesn't know. He may be having a prostate cancer. So if he is having prostate cancer and he is ignoring his symptoms, the prostate cancer will spread
Mm.
if he keeps on ignoring because symptoms will be same.
Right.
So
Right.
when one is having symptoms, he or she, in this case it is only he has to
Mm.
show to a urologist. It
Mm.
is for the urologist to decide what is the cause of symptoms, whether this can be ignored, whether medicines can be given, whether he is having prostate cancer. So it should not be ignored. It is just one OPD visit. What's the harm in that?
Mhm. Exactly. And the way you have just explained it could be, I mean, God forbid, but it could be malignant also. So it's always good to get it checked as soon as possible. प्रोस्टेट कैंसर पर भी थोड़ी बहुत बात हम बाद में करेंगे, लेकिन अभी अभी चूंकि हम बीपीएच पर बात कर रहे हैं डॉक्टर, नॉर्मली एट व्हाट एज people start having BPH or these symptoms?
It starts at about 50 years of age,
Mm-hmm.
and the incidence keeps on increasing by 10% as you grow older by 10 years. So at 50, there are some set of around 40-50% patients. At 60 years, it is 60%. At 70 years, it is 70%. As the population keeps on increasing, the incidence of BPH or prostatic enlargement in the population keeps on increasing with aging because it's an aging process.
Mm-hmm. Right. ओके। एंड जैसा कि आपने कहा कि सिम्टम्स है तो इग्नोर नहीं करना है, डॉक्टर के पास जाना है, करेक्ट डॉक्टर के पास जाना है विच इज एन यूरोलॉजिस्ट। लेकिन अगर सिम्टम्स नहीं है, क्या ऐसा भी हो सकता है कि ये सिम्टोमेटिक हो, सिम्टम्स नहीं है लेकिन एनलार्जमेंट ऑफ प्रोस्टेट या प्रोस्टेट ग्रो हो रहा है?
Yes. There are many patients which are, see, enlargement of prostate, we are not worried because the patient is not having any symptoms. The
ओके।
patient is not having any symptoms, why he or she will go to a doctor anyways, right? Only when the
एग्जैक्टली।
patient is having symptoms, he or she is feeling bothersome, then only he goes to the patient, right? And
राइट।
if sometimes what happens is he is getting treatment for some other disease, right?
हम्म।
Like some abdominal cause, some pain in abdomen, that the other doctor gets an ultrasound done, and
हम्म।
there he finds that there is an enlargement of prostate, then he refers the patient to us. right?
Mm.
In such a scenario, we just make sure that the enlargement of prostate in him is not because of cancer. If it is not because of cancer and he is not having any symptoms, we don't treat them.
Mm.
We don't treat
Okay,
them.
so there
So
is
these
no need of treatment, right?
treatments.
Because what happens many a times, especially after a certain age, people normally go for medical checkups or annual medical checkups or 6 monthly medical checkups and scans, etc. तो कई बार वहां पे भी पता चलता है कि अरे प्रोस्टेट ग्रो कर रहा है, लेकिन एज यू सेड बस आप ये मेक श्योर करते हैं कि वो मेलिग्नेंट नहीं है।
Yes,
अगर नहीं
yes.
है और सिम्टम्स नहीं है तो
No, no need to,
जरूरत
no need for treatment.
हम्म। एक क्वेश्चन ये भी बहुत आम होता है मेल्स में कि ये जो बीपीएच है, या जैसा कि बहुत अच्छे से आपने पहले एक्सप्लेन किया कि ये बेनाइन ग्रोथ ऑफ प्रोस्टेट है, तो ये बेनाइन भी क्या बाद में मेलिग्नेंट हो जाता है, हो सकता है, ऐसे केसेस आते हैं क्या?
See, अगर मैम malignancy can happen at any time, right? It can happen. There is an enlargement of prostate. It may malignancy can start at 70 years. It can start at 75 years. We don't know when malignancy will happen in anybody.
हम्म।
But if we have two tests when the patient comes to us. One is the rectal examination of the prostate, which we do as an examination, and one is the PSA, which is prostatic specific antigen. It's a blood test. So these two tests, if they are normal, the chances of malignancy are very, very less. And we keep on doing these annual. If the examinations are normal the first time, we generally call them after 3 or 4 years for a re-examination, just to make sure that he is not developing any malignancy. So
ओके।
it's a
अच्छा।
lifelong process. 3 4 years, after 3 4 years, get yourself checked again. After 3 4 years, get yourself checked again. If you're not having symptoms, if you're having symptoms, then we'll call them regularly.
Right, right. And is there a relation between the family history, अगर family history है, prostate cancer की I'm talking about, because BPH तो चलो एक natural aging process है, अगर prostate cancer की history है, तो क्या chances बढ़ जाते हैं? Is it a risk factor?
Yes. Yes, ma'am. अगर prostate cancer की history है, in fact, if there is a history of any cancer in the family, the chances of prostate cancer increase in
Okay,
that individual. Yes.
okay.
It's
और
an
इस
it's
केस
an
में क्या करना चाहिए?
regular screening.
Okay.
Go to your doctor regularly, as and when he calls. Get yourself screened. He'll get you screened more often than an individual who does not have a history of cancer in the family. So maybe after 2 years, he'll get a PSA done. After every 2 years, and
PSA is a blood test only, or yeah, it's
yeah,
kind of
it's
a
a blood
blood
test.
test?
Yes,
Mm-hmm.
it's not kind. It's blood test only.
It's blood test only. Okay,
Prostate
right.
specific antigen, which measures it gives an idea about the risk you are having of prostate cancer in a prostatic enlargement.
हम्म। प्रोस्टेट कैंसर के केस में डॉक्टर ये कहा जाता है कि ये एक बहुत स्लो ग्रोइंग कैंसर है। आमतौर पे कैंसर जो है वो बहुत एबनॉर्मली सेल्स स्प्रेड हो रहे हैं, बहुत जल्दी फैलता है, लेकिन प्रोस्टेट कैंसर में आई थिंक दैट इज द ओनली सिल्वर लाइनिंग दैट कि वो स्लो ग्रोइंग होता है। तो
Yes.
ये किस तरह से एक अच्छी चीज है, और किस तरह से अगर अर्ली डिटेक्शन हो जाए प्रोस्टेट कैंसर का, तो जो पेशेंट है वो एक अच्छी लाइफ जी सकता है।
Yes. Out of all the cancers which we have, prostate cancer is one of the slowest growing. मतलब सबसे slow grow करता है, सबसे slow फैलता है, and इसका disease spectrum is मतलब life is quite long. Even if you don't get treatment, then also आपकी life expectancy is quite high. लेकिन अगर आप इसको early detect करके treat करते हो, it is completely curable. It is completely curable now. So that's the good part about prostate cancer. The bad part is the patients don't get themselves screened. The patients don't come early, and especially in our setup, in Indian setup, patients
हम्म।
are reluctant to come to. They don't have awareness. I think they need to be taught. If they are taught and they are well aware, everybody will come and get a screening done. Like in advanced countries, in Western countries, this screening is must for after 50 years of age. It is ingrained in your insurance. So the patients there go regularly, get themselves checked. That is why the chances of screening and detecting early cancer, especially prostate cancer, breast cancer, cervical cancer, is very high in Western countries. We
Right.
encounter patients who come at a later stage when they
Mhm.
already have a spread of prostate cancer.
Mhm.
So if you're
Right.
having symptoms, that is what I was telling you. Na? If the patient is
Mhm.
having symptoms, he or she does not know whether it is because of prostate cancer or because of benign prostatic hyperplasia.
Benign,
You
right.
may you may assume that yourself that it is aging or it is benign, but show yourself to a doctor who has to make sure that it is benign
Even
only
to
and not
rule out
malignant.
that it's not malignant, even to rule out that point, the doctor need to diagnose you.
Yes.
Correct. Now, as you said, the symptoms are same. So are they completely same, or there are some more, add-ons in case of prostate
No,
cancer?
no, same.
Mhm. Because one of
That is
our,
also enlargement of prostate. This is also enlargement of prostate.
it's one is benign and one is malignant.
Yes.
Mhm. So when a patient comes to you, in both the cases, you said you get a PSA done, or there were other tests as well. Are there other tests that you also do?
Ma'am, we have to get one is uroflowmetry, where we check the flow of urine. It's a office-based test. The patient has it's a special toilet with a machine attached to it,
Hmm.
and the patient passes urine in that toilet, and we'll get a graph of the speed of his urine with respect to time. So
Hmm.
we'll come to know exactly objectively what is his speed, what is his flow of urine, and we can assess whether the flow has decreased. There are various graphs which come, there are various causes which lead to decreased flow. One of the causes is BPH, so we can get an idea. Second of all, we get an ultrasound done to know the exact size of prostate, whether there are any changes in the kidneys, any dilatation of the kidneys. Overall, what is the imaging of the urinary tract? Then PSA is one. And examination, we do a digital rectal examination. These are the four basic tests we do. And depending on the results, we further plan what to do.
Mhm. And if at all it comes that it is malignant, now then what do you do as a doctor? What is the line of treatment? What are the treatment options available? And again, to find out the stage, etc., or the spread, etc., do you do? I'm sure there are further tests for that.
Yeah. If there is a suspicion, because all these tests they raise a suspicion of prostatic cancer, right? It is not confirmatory. PSA is not confirmation. It
Right.
is a suspicion. We have a suspicion that the patient may have prostate cancer.
Mm-hmm.
So if there is a suspicion and there are findings that we think corroborate and there is a high chances that there is prostatic cancer, we get a biopsy done of we do. In fact, urologist has to do a prostatic biopsy under ultrasound guidance. We take out small chips of the prostate under ultrasound and send it for pathology. And if the pathology from there, their confirmation comes whether the patient is having prostate cancer or not. If the pathology comes that there is prostate cancer, we then we have to. It's a long algorithm. Then what is the spread of prostate? How much is that spread? Various grades which come in the pathology report. According to that, we decide the treatment whether the patient has to be given chemotherapy, radiotherapy, surgery, then. And if the prostate biopsy is negative, benign, then you treat it as benign prostatic hyperplasia.
Mm-hmm. As we were talking that, growth of prostate happens only after a certain age. It's a process of aging. So I'm sure it's the same with the, malignant enlargement of prostate. तो ऐसे में जब एक सर्टन एज के बाद हमें पता है कि ट्रीटमेंट्स या हीलिंग प्रोसेस खास तौर पे वो थोड़ी स्लो हो जाती है. So if a person is of the age of 70 और उन्हें प्रोस्टेट कैंसर डिटेक्ट होता है, तो किस तरह से लाइन ऑफ ट्रीटमेंट आप डिसाइड करते हैं? कौन से ऐसे फैक्टर्स हैं जो ध्यान में रखे जाते हैं, अगर क्योंकि इस कैंसर में तो ऐसा लग रहा है कि एक सर्टेन एज के बाद ही ये कैंसर हो रहा है.
Yes, majority of the cancers they happen in old age.
हम्म.
All the cancers,
हम्म.
generally they happen after old age. And depending कि वो spread कितना किया है, उसका grade क्या है, we treat those cancers, especially in prostate cancer. As we have already told, it is one of the slowest growing cancers. The treatment have advanced radically in the last few years, So there are a lot of options now, but still the best option is if the patient has local spread of prostate, it is confined locally to prostate. The patient is having good, healthy, life, and the patient is overall healthy. Then
Hmm.
surgery is the best option. There are now clear-cut trials are there which suggest that there is robotic radical prostatectomy. The surgery name is there. Through a robot, we do a radical prostatectomy. We remove the cancerous growth, completely the prostate, and the patient is cured. And his quality of life after that surgery is as good as it was before. It's
Wow.
done by a robot, and there are only four small sutures given in the abdomen. Nothing, no big scars, no big suture line, nothing.
Mhm. That's a good news, I guess. So that way, yeah, definitely, because there is so much of advancement happening in medical science. तो ये एक अच्छी खबर है लोगों के लिए कि आसानी से इसका ट्रीटमेंट भी हो जाता है। लेकिन सबसे इम्पोर्टेंट बॉटम लाइन जो हम शुरू से बात कर रहे हैं कि अगर ये सिम्टम्स है, क्योंकि हमें नहीं पता है कि ये हमारे डायबिटिक होने की वजह से है या
Yes.
प्रोस्टेट एनलार्जमेंट की वजह से है या एजिंग का प्रोसेस है, जो भी है, प्लीज डू नॉट इग्नोर दी सिम्टम्स। What happens, डॉक्टर, आई एम श्योर यू गेट पेशेंट्स लाइक दैट, जब वो आते हैं और उनसे पूछते हैं और वो बताते हैं कि ये सिम्टम्स हैं जो आपने भी बताए, और उनसे ये पूछते हैं कि कब से ये सिम्टम्स है, तो उन्हें खुद भी याद नहीं होता क्योंकि
Yes.
इतना लंबा वक्त हो जाता है, एंड दे स्टार्ट लिविंग विद इट। उनको लगता है कि अच्छा ठीक है, मतलब रात में 2 ही बार तो उठ रहे हैं, 3 बार ही तो उठ रहे हैं, सब लोग उठते हैं, लेकिन सब
Yes.
लोग नहीं उठते हैं, ये बाद में पता चलता है डॉक्टर के पास जाकर। तो एक जनरल आइडिया के लिए कि नॉर्मली हम दिन में कितनी बार वॉइड होने के लिए, या चूंकि हम बीपीएच की बात कर रहे हैं, प्रोस्टेट की बात कर रहे हैं, मेल्स की बात कर रहे हैं, तो नॉर्मली ये मेल इन आवर सोसाइटी कितनी बार अवॉइड होने के लिए नॉर्मल सर्कमस्टांसेस दे गो, और नाइट में कितनी बार इज नॉर्मल?
See, in daytime it is 6 to 7 times you can go,
हम्म।
right? Nighttime generally once. Once. This is the normal cutoff. This is also once at night also if you are in 40s or 50s. In
हम्म।
younger age, you never get up, not even once.
हम्म।
So if you are going once and it is not hampering your quality of life, it's fine. That is the normal. And you are getting 3 times, 4 times, that is not normal. That can never be normal.
हम्म। राइट। पानी को लेकर भी एक सवाल, क्योंकि अगेन हमारी सोसाइटी में कहा जाता है खूब सारा पानी पियो, और कई बार सुबह उठ के एक जग भर के पानी पीना, रात को सोने से पहले। इनफैक्ट एज वी आर टॉकिंग अबाउट एजिंग पीपल, एजिंग मेल्स, मान लीजिए वो रात को एक बार उठे यूरिनेशन के लिए, दे विल कम बैक, दे विल हैव वन मोर ग्लास ऑफ वाटर, देन दे विल गो टू स्लीप, दे विल अगेन गेट अप, गो वॉइड देमसेल्फ, कम बैक, डू द सेम प्रैक्टिस। व्हाट्स योर टेक ऑन दैट? एडिक्वेट
Man,
वाटर, इसका क्या
yes.
डेफिनेशन है?
If you are asking me about BPH, अगर BPH का patient diagnosed है and he is having problems, we tell them a set of instructions. These are called as lifestyle modifications, right?
हम्म।
The number one thing about is liquids, right? Liquids में जैसे पानी आता है, we tell them कि till 4, मतलब दिन में आप जितना मर्जी पानी पीजिए, doesn't matter, till 5 o'clock, 6 o'clock, you drink as much water as possible. After 6, decrease your intake of water. At night time, right? Take your dinner at least 2 hours before going to bed. Suppose if you go to bed at around 10, 10:30, then 8 o'clock, take your dinner. After dinner, take just one glass of water. You are allowed just one glass of water, not more than that. Before going to bed, you have to go and pee, right? Go to your toilet, uh, do urination, and then sleep. Whenever you get up at night for urination, you after urination, if there is thirst, just 1 or 2 sips of water you are allowed to drink at night, not a whole glass of water, because then if you drink a whole glass of water, you'll keep on getting up, right? These are the first set of instructions. Second set of instructions are don't drink alcohol at night, right? A lot of people take if they're especially in Punjab, they take alcohol at night. So we tell them
Hmm.
avoid alcohol. It's a diuretic. It will increase your urination at night. Avoid carbonated beverages in the evening, like Coke or coffee or tea. All have to be avoided after 5 p.m. These are all diuretics. So you have to avoid them. So these are the basic lifestyle modifications we tell them. Quit smoking, you know.
Hmm.
These are the instructions which have to be told by to every BPH patient, and it makes a lot of difference.
Hmm. कई बार ऐसा भी होता होगा, आई एम श्योर, कि सिर्फ लाइफस्टाइल मॉडिफिकेशन से ही जो सिम्टम्स हैं वो कम हो जाते हैं, ऐसा पॉसिबल है?
Yes, a lot of the patients, 50% of the patients, they have relief just by lifestyle modification, 40 to 50%. Because
That sounds good.
many times, there is a habit that patients have a glass of milk at
Hmm.
night
Before going
before
to
going
bed,
to
right?
sleep. A
Hmm.
lot of people have this,
Hmm.
and they keep on because it's a habit they have had for decades. So we
Hmm.
have to tell them, you have your milk, but do it in day. Drink your milk in day, not at night at this
Hmm.
age.
Hmm. आम तौर पे एक प्रोस्टेट का जो वेट है डॉक्टर, वो कितना होता है? 15-20 ग्राम्स?
Yeah, 20-25 grams. Yes.
ओके। और कितना तक वो बढ़ता है? कई बार ऐसा होता है कि पेशेंट्स ये बोलते हैं कि जैसे अल्ट्रासाउंड कराया और पता चला कि मे बी 100 ग्राम्स का प्रोस्टेट हो गया है। कई लोग होते हैं जिनका मे बी 30-35 होता है, लेकिन जिनका 30-35 ग्राम्स का होता है उनको ज्यादा सिम्टम्स होते हैं, और 100 वाले को कई बार कम होते हैं। ऐसा भी हो सकता है क्या?
बिल्कुल होता है मैम. See, prostate weight and symptoms don't correlate. There is not
ओके।
an equal correlation नहीं है. Exactly like you are telling 30 grams वाले को भी बहुत ज्यादा symptoms हो सकते हैं और 100 वाले को बिल्कुल भी नहीं हो सकते.
हम्म।
So we just have to make sure कि उसको malignancy ना हो. बस that is the only thing which we see. लेकिन अगर 100 grams वाले को भी symptoms नहीं हो रहे,
हम्म।
we don't treat them. There is
हम्म।
no treatment needed because he is asymptomatic.
हम्म। जैसे कि आपने पहले बताया कि अगर
अगर
malignant
सिम्टम्स
नहीं
हैं
है।
तो
हाँ।
ट्रीट करो. अगर
हाँ।
सिम्टम्स नहीं है तो ट्रीटमेंट की कोई जरूरत ही नहीं. फिर किस बात की ट्रीटमेंट? ही इज ऑलरेडी फाइन.
राइट। एक हमारी व्यूअर है दिव्या बगानिया। मेरे ख्याल से वो अपनी फैमिली किसी मेंबर के लिए ये क्वेश्चन पूछ रही है, और उन्होंने सेशन चूंकि लेट सुनना शुरू किया, तो शी इज आस्किंग अबाउट द सिम्टम्स ऑफ एनलार्ज प्रोस्टेट। अगर एक बार फिर आप सिम्टम्स बता दें क्या क्या होते हैं।
Symptoms are decreased flow of urine, increased frequency of urination, urgency, hematuria, acute retention of urine, and recurrent urinary tract infections. These are the symptoms.
राइट। एक और हमारे व्यूअर है, हालांकि इस पर भी हम बात कर चुके हैं कि लार्ज प्रोस्टेट कैसे डायग्नोज होता है। एक राहुल बत्सवार है, उनका सवाल है, कैन लाइफस्टाइल चॉइसेस इन्फ्लुएंस प्रोस्टेट हेल्थ?
No, no, no. Lifestyle choices can influence your symptoms of
हम्म।
prostate, like I have already mentioned, but lifestyle choices per se will not have any effect on benign prostatic hyperplasia. Your lifestyle choices may have an effect whether you'll get a malignancy or not. Suppose you are having tobacco, suppose you are having uh, carcinogenic additives in food products.
हम्म।
Tobacco is one thing which can cause prostatic carcinoma, malignancy. So, in that sense, yes, your lifestyle modification, if you are giving up tobacco early in your life, when you are young or you have not taken tobacco, then your chances of malignancy of prostate will decrease definitely. But benign prostatic hyperplasia, no, that's an aging process.
मतलब बहुत आम भाषा में मैं कहूँ तो जैसे हम लोग कहते हैं ना कि प्रिकॉशन इज ऑलवेज बेटर देन क्योर, तो ऐसा कुछ हम नहीं कर सकते प्रोस्टेट हेल्थ इंश्योर करने के लिए या
Perfect.
सिम्टम्स
हेल्थ
नहीं
इंश्योर
उसके।
करने के लिए टोबैको छोड़ो मैम.
हाँ,
टोबैको
राइट।
छोड़ो. योर चांसेस ऑफ malignancy, carcinoma of every type, right
हम्म।
from head till toe, all the cancers are related to tobacco. And अगर आप tobacco कम करोगे, all these cancers will decrease.
आई थिंक दैट्स ऑल्सो वेरी इम्पोर्टेंट टेक अवे कि अगर हम टबैको इनफैक्ट क्योंकि आजकल कैंसर के केसेस इतने ज्यादा बढ़ रहे हैं तो एक चीज छोड़ने से अगर पूरा जैसा डॉक्टर ने कहा हेड टू टो जितने भी कैंसर होते हैं उनका एक मेन कॉज जो है टबैको होता है, वैसे में उसे अगर हम छोड़ दें तो एक बहुत बड़ा कदम हम गुड हेल्थ की तरफ और मेलिग्नेंट फ्री हेल्थ की तरफ बढ़ाते हैं, तो वो आई थिंक बहुत एक इम्पॉर्टेंट बात होती है। प्रोस्टेट से जुड़ी हुई और कोई बात, एक तो बहुत इंपॉर्टेंट आपने कहा कि टबैको कंजम्पशन बंद करना चाहिए, और कुछ जो हम कर सकते हो, एक हेल्दी लाइफस्टाइल किस तरह से मेंटेन करें कि हमारा प्रोस्टेट हेल्थ जो है वो मेंटेन हो।
You should not be overweight.
ओके।
Your weight should be good, and you should exercise regularly. These are the things which will help in overall health and your prostatic health.
Right. So these are the things that we can do. And of course, a stress-free lifestyle is what everybody suggests. लेकिन वो थोड़ा मुश्किल होता है, but हाँ, अगर हम उसे किसी भी तरह से मैनेज कर पाए तो वाकई में it goes a long way in maintaining good health. इस सेशन को सम अप करते हुए डॉक्टर, कोई ऐसी बात जो आप कहना चाहें, या एक बार फिर से आप डूज एंड डोंट्स लोगों को बताना चाहें, या क्या करना है क्या बिल्कुल नहीं करना है, क्या आप कहना चाहेंगे कंक्लूड करते हुए।
Conclusion में मैम, first of all, aging के साथ everybody is going to develop health issues. Various
Right.
type of health issues related to prostate, related to other symptoms. तो जनरल एडवाइस पहले तो ये है कि इफ यू आर हैविंग सिम्टम्स ऑफ एनी काइंड, प्रोस्टेट के तो है ही है, यूरिन के सिम्टम्स आ रहे हैं अगर आपको, वैसे भी इफ यू आर हैविंग एनी काइंड ऑफ सिम्टम्स, just show yourself to a doctor concerned with that specialty. Don't ignore your symptoms, because it is very, very easy to treat a person who is having milder disease as compared to somebody who has kept on ignoring his symptoms and has landed up in a severe disease. To treat a severely diseased person takes a lot of effort, a lot of uh, effort from the doctor and also from the patient and his family. And the financial costs of treating a severe patients are much, much more as compared to treating somebody who is landed up with a mild disease.
Right.
Patients thinking that I am saving going to a doctor and saving my OPD slip, because I am having
Mm,
mild symptoms, I'll keep on
mm,
bearing. Keep on bearing or not, that is for you to decide. But show yourself so that at least you get to know what is causing the symptoms. The doctor will explain to you. You may or may not like his treatment. You may or not take his treatment, but at least you will have a knowledge ki what is causing me symptoms. Then you decide whether you want further treatment or not. In
mm.
prostate, also in any other condition, as you are aging, if you're getting a symptom, show yourself to doctor, and it is much better for you and your family, right? First of all is,
बिल्कुल।
second of all, अगर आपको symptoms आ रहे हैं and your doctor has advised, see, in for with us now to manage benign prostatic hyperplasia specifically, there are a lot of treatment options. With the advancements in medicine, we can give you lifestyle modification options. We can give you medical options, that is pills. The medicines which we give are very, very effective nowadays. And if earlier without earlier there used to be only surgery.
Mm,
There about 2-3 decades ago, there was no medical management of prostate, only surgery was there.
mm,
So as compared to that, if earlier we used to operate 100 patients without medical management, with medical management, out of those 100 patients, 90 are managed with only medical management nowadays, not with surgery. Those who
mm,
are not responding to medical management are taken up for surgery, right? So there is and you just have to take one pill once a day. That's it. And all your symptoms will improve, all your quality of life will improve, and you will be leading a much better and healthier life. Your sleeping will improve, your daytime attention will improve. All these are benefits just by taking one pill. And if
mm.
you're not even managed by that, then we have very good surgical options now. Earlier, there used to be a big scar for prostate. It used to be a very, very morbid procedure. Now, with the advent of lasers and microsurgery, we are doing it scarless, sutureless, and 1 day process. Come in the morning, get yourself operated. Next day, the patient is discharged. There is no incision, there is no suture, and all the patients, I tell you, see, surgery for anybody, even
Mhm.
for me or for anybody, is a scary, thing to
Right.
get surgery done. There are a lot of ifs and buts. There is a lot of apprehension, and rightly
Mhm.
so, because it says you are going under the knife, right?
Right.
But with the advancements of technology and with the kind of surgeries we are doing right now, the pain is minimal, very, very, because there is no cut, right? Very less pain. Next day discharge. The patient is symptom free for whole of his life. And all the patients, believe me, all the patients after getting surgery generally tell me, बस ऐसे ही डरी जा रहे थे सर हम, ये पहले क्यों नहीं
राइट
कराया.
बिल्कुल और इन सब की शुरुआत होती है सिम्टम्स को इग्नोर ना करके सो प्लीज अगेन डू नॉट इग्नोर योर सिम्टम्स इफ यू हैव दीज सिम्टम्स गो गेट इट डायग्नोज गेट इट चेक go to a qualified urologist. Thank you so very much, Dr. Varun Wats. It was wonderful talking to you. Thank you so very much for such an informative session. Thank you,
Thank
sir.
you, man. Thank you.
And viewers, thank you for your active participation. For more information and updates, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you.